Hi friends, let me today talk to you about shoulder examination, which is quite a common presentation and a situation that happens in the emergency department. Yeah, because you may get a patient may come in with severe pain of the shoulder with difficulty moving, possibly after an injury. And in these scenarios, when you approach the patient, so first of all, take a holistic approach, understand from the patient their age, sex, what is their occupation, their past medical history, what are they able to or unable to do because of the shoulder problem, and what is their understanding of it and their expectations. Then after this, move on to the examination, take consent for the examination, get a chaperone, ask them to take off their upper body clothing like shirt, see how they are able to take off the clothing by themselves or do they need assistance doing stuff, and start with a very standard look, feel, move, and then moving on to the special test. So when you look at the patient, look at how much pain are they, what are they able to do generally, and then you begin by looking. So look, check the symmetry of the both the joints, check for any swelling or deformity. Move on to feel, where you would check for any local warmth, crepitus, or localized tenderness. Then movement, which would be should be active and passive, so whatever they are able to do. So the joint movements or shoulder movements are abduction, when arm away moves away from the midline, adduction towards the midline, flexion, which is forward flexion, extension is backward movement of the arm, and internal rotation, external rotation. So, and whatever the patient is able to do actively, and then if they are not, then assist them. And this often differentiates between a joint problem, or whether it is a problem because of an anatomical or structural defect or deformity, or is it because of pain, if you are able to do passively. Hence, a simple screening movement test you could do is ask them to put their hands on their head, which would suggest that there is no impingement. So now you look and then you move on to doing the special test. Now, before we do that, let us just quickly look at the shoulder joint, which is made up of the humerus, the where the head from the neck, and then the head of the humerus gets into the glenoid capsule of the scapula, and then there is the acromion process that connects with the clavicle. So, and then we move